Good afternoon, everyone. My name is Christy Matheson. I'm the Director of Media Relations for the province, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Minister of Health and Wellness, the Honourable Michelle Thompson, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Minister.
Thank you. Good afternoon, everyone. Dr. Strang and I are here today to talk about the recent rise in cases and what that means for Phase 5. The fourth wave has been rolling across Canada. It's in New Brunswick and PEI, and now it's here. Along with the outbreak in northern Nova Scotia, we are seeing some signs of community spread in Halifax. Most of these cases are among the unvaccinated, but we are seeing a few breakthrough infections as well. 4 people are in hospital. The Premier and I are very troubled by this. To say the least, this is not where we want our epidemiology as we're set to go into Phase 5. Today I am announcing Phase 5 will be delayed until October 4th. I know this is disappointing for many people. I've met with the Premier to discuss these changes, and he has trusted me today to deliver this news. Nova Scotians have worked hard. They've worked very hard to get us to this point, and I know that you are tired of restrictions. But this province has weathered the pandemic better than most provinces because Nova Scotians do what's needed to keep their family, friends, and communities safe. And staying in Phase 4 is necessary until we have the added protection of the proof of vaccine policy that will allow larger groups of people to gather more safely. It is better to keep the status quo for a little while longer in order for these cases so we can move into the next phase. Doing that could mean bringing, it's better to keep the status quo for a little while longer than to ignore these cases and move into the next phase. If we do that, doing that could mean bringing in far stricter restrictions later and slipping backwards. None of us want that. We've been successful using our multi-layered and very cautious approach. The best way to protect yourself, your family, and your community is to get vaccinated. The vaccines have been thoroughly tested and are safe and effective. As of today, we have 72.2% of Nova Scotians fully vaccinated. Since our last news conference, more than 5,000 Nova Scotians have signed up to get their first dose, and I want to thank you. I'll now turn it over to Dr. Strang.
Thank you, Minister, and welcome, and it's a great pleasure to be working with you. And good afternoon to everybody. As people have likely seen, our case numbers have been increasing over the last few days, not just here, but also in our neighboring provinces. The fourth wave is hitting Atlantic Canada, and as we've seen elsewhere, it's having much more of an impact on those who are not vaccinated. We are still seeing several or a number of cases related to travel, but there are 2 concerning clusters that we're watching closely. One is in Central Zone among people aged 20 to 40, mostly unvaccinated and with very active social lives. We're seeing some signs of community spread as public health does their case and contact follow-up, and that is concerning. There's another large cluster in Northern Zone and a well-defined, relatively closed, unvaccinated group. This group has a lot of interaction with one another, and so we're certainly expecting continuing cases in that community in the days ahead. And we're closely monitoring this for signs of spread into the surrounding community, but fortunately there is no such spread at this time. None of this is really a surprise. We fully expected the fourth wave to bring more cases, but I know it's worrisome. We are in a transition period where we have growing vaccination rates, but we're also experiencing the fourth wave of the virus. So that's why we're leaving restrictions in place for 2.5 more weeks and delaying the further reopening. Moving into Phase 5, where mandatory measures like physical distancing and masking become voluntary, and there are no gathering limits, was dependent on 2 factors: having at least 75% of the entire population fully vaccinated and the epidemiology. The good news is, as of today, we're at 22.7% of the population fully vaccinated, and more people have gotten vaccinated last week and this week than in a number of previous weeks. So certainly we've had a significant increase in the uptake of vaccination very recently. But given where things are here, as well as in New Brunswick and PEI, I am not comfortable moving into phase 5 just yet. It is far better to wait until we're ready to implement our proof of vaccine policy. This means that when we loosen restrictions to allow larger gatherings, our new policy will be in place to allow these gatherings to happen as safely as possible. It will also give us time to understand the current clusters and monitor for any spread. I know this is not welcome news, especially for businesses that have been waiting for us to fully reopen. And I know we're all tired, or many people are tired of wearing masks and being restricted by gathering limits. But unfortunately, this pandemic is not done with us yet. For clarity, staying in phase 4 for the time being means mandatory masks continue in indoor public places, including schools. Physical distancing continues, and the gathering limits that are currently in place will remain being applied. Our testing strategy is also changing, given we now have a highly vaccinated population. It will be more targeted to people who are unvaccinated and those in high-risk situations. And while regular asymptomatic testing is winding down at primary assessment centers, we will have targeted asymptomatic pop-up and mobile testing continuing to be available in communities with higher cases and signs of possible community spread. This means that pop-up testing sites in Halifax and Dartmouth will remain open for the time being, and other sites across the province will be opened as pop-ups or time-limited testing opportunities if and when they're needed. Asymptomatic testing will continue to be available through primary assessment centers when recommended by public health, such as for close contacts of positive cases. And of course, anyone with symptoms, and if you don't know the symptom list, it is go to our 811, you can call 811, or you can go on our COVID website and look up the symptom list there. So anyone with the symptoms should get tested, and the testing options will continue to be widely available across the province. We need to make sure we have good access. People who have symptoms that could be COVID need to be able to get quick access to testing. So our testing strategy is changing given we have an increasingly vaccinated population. And as I said, we'll be more targeted to people who are unvaccinated or in communities with increased risk. I know there's been a lot of questions and concerns about those changes, but we need to focus our targeting. We don't need people who are fully vaccinated at low risk for getting COVID that still continue to have regular testing. The chances of them, if they don't have symptoms, having a test is very, very low. We know that there are already a number, continuing on kind of our delaying the phase 4 opening. We know that there are already a number of large-scale events that are which will plan to take place at entertainment venues, theaters, or performing arts facilities before October 4th, where tickets or registrations have been confirmed or the tickets have been sold. These events will be allowed to proceed between today and October 4th and operate at full capacity, but the venues must enforce mandatory masking and ensure all attendees are fully vaccinated. And we'll be working with our colleagues in Community, Cultures and Heritage and Events Nova Scotia with these facilities to make sure that anybody who has already bought tickets is made well aware of the requirements for masking and vaccination. There have been a lot of questions about our proof of vaccine policy, and I'm pleased to share a bit more detail today and tell you what is included or who is included and who is not. There are still some details to be finalized, including things like the process for people who can't get vaccine for valid medical reasons, and we're working on this, and we'll share this as we put final things in place. But for now, I can tell you where the policy will and will not apply. And in generally speaking, it will apply to places where groups of people gather together for discretionary activities. So starting October 4th, people who are 12 years of age and older will need to provide proof of vaccination to participate in the following events. And this policy does apply to both indoor and outdoor activities. bars, casinos, and full-service restaurants, but not at restaurants whose primary business model is fast food or takeout or drive-through. At fitness, recreation, and leisure businesses and facilities. At social events, festivals, performances, and special events, unless they are special events outdoors in a public space where there is no specific entry point. So some kind of a festival on the waterfront, or the Nocturne, which is planned for outdoor in Dartmouth. The policy will apply for people attending as well as people participating in sports events. It applies to people going to museums, public libraries, and the Art Gallery of Nova Scotia. It applies for weddings, funerals, receptions, and visitations that are being held by a recognized business or organization. If it's not, if it's, for instance, it's just a simple small family wedding in a backyard, then the proof of vaccination does not apply. But if it's held by a recognized business or organization, then it does apply. On the flip side, proof of vaccination will not be required for places that do not facilitate formal gatherings, such as retail stores, banks, and professional services such as accountants and lawyers, personal services such as hair salons, barbershops, spas, and body art, healthcare services and health professions, rental accommodations such as hotels, motels, faith services, school-based activities that take place during the school day, before and after school programs, and on school buses. And as I said, informal gatherings at a private residence. Any of the businesses and organizations that offer these services or activities certainly can have their own vaccination policies, but we need to remember that organizations that aren't covered under the provincial proof of vaccine policy and want to have and choose to have their own vaccination policy, that they need to remember that people who are not fully vaccinated must be able to have access to essential services. It's also been decided that proof of vaccination will not be required under this provincial policy for employees of businesses and organizations that offer the events and activities that I listed above. However, businesses and organizations are encouraged to set their own vaccination policies, taking legal and ethical implications into consideration. And finally, I'll note that we have a grace period for children who have turned or are turning 12. If they have turned 12 between January 1st and October 4th of 2021, they will have until December 31st to attend events and activities without requiring proof of vaccination, and it gives them time to get vaccinated. For children who will turn 12 on October 4th or afterwards, they will have 3 months from their birthday that they will to get vaccinated, and they'll be able to access events without proof of vaccination in that 3-month period. Moving on, I want to talk about some news that has come out last Friday from the National Advisory Committee on Immunization about third doses for people who have compromised immune systems. After reviewing the latest evidence, NACI recommends that some immune-compromised people should receive a third dose of an mRNA vaccine, Moderna or Pfizer, to increase their immune response. We will be following the NACI recommendations and are now working in a process for those specific conditions which are eligible to receive a third dose. And we'll have more details on this and the process to get vaccinated very soon. And let me close by speaking to those who are not yet vaccinated. I understand that some people have different perspectives about getting vaccinated, and that choice is important, especially when it comes to our own personal health and well-being. But personal choice cannot be all you think about when it comes to COVID vaccines. I'd ask that you think about others and that you focus on the we, not the me. The choice to be vaccinated or not has implications for everyone around you. We are experiencing a pandemic of the unvaccinated. Because of the risk of further spread, we're having to slow down our reopening. That impacts directly people, families, the healthcare system, and our economy. And we still have to be cautious. Broad spread of the virus among unvaccinated Nova Scotians will create pressure on our healthcare system. We know that already the hospital in Truro has had to stop elective surgeries because of the pressures from what's happening in that part of the province. So we know that the broad spread will create further pressures and could prevent people from accessing critically urgent, non-COVID healthcare services. That is happening in other parts of the country. So I'd ask that you think about this when you're making your choice. And please ensure that you're basing your choice on solid, grounded science. We all trust it for the majority of things we do in our daily lives. And the COVID-19 vaccine is no different. It has already saved many lives in this pandemic, and it could save yours. And to all Nova Scotians, please treat everyone around you, whether in person or on social media, with caring and kindness, even if you disagree on an issue or a decision.
Thank you, Dr. Strang. We'll now take questions in the room and on the phone, beginning in the room.
Dr. Strang, can you talk a bit more about what's going on in Northern Zone, specifically with this group of people, and to what degree does that group include people who are younger than 12?
So we have a significant community who interact mostly amongst themselves. That they've had, they don't by choice. They're not vaccinated. They have a very young demographic. Lots of young people in the community. They have a significant spread of COVID within that community. So we are supporting that community. The community has been very cooperative as we work with them. We're making sure that they're limiting, if wherever possible, any of their interactions with the surrounding community, and they're very cooperative with that. And as I said, we have no cases at this point in time where there's been spread beyond this community.
Can either of you speak to the severity of the cases you're seeing within that cluster? And Minister, do you have any information that you can provide to us about to what degree, if any, that cluster may be affecting the healthcare system within that area and its ability to not only treat these folks, but deal with the run-of-the-mill business that it would normally see?
So I don't have information that it's negatively impacting the healthcare system around them right now. The community is working closely with public health, and symptoms are being monitored. And my understanding is, Dr. Strang, that overall the cases have been reasonably mild to moderate.
Yeah, we've had out of that, and there's a large number, well over up in the well over 100 in the community. There's been 3 hospitalizations from that, but the vast majority are mild to moderate cases. So we're working with the community. We have to be very careful about further describing the community for privacy reasons, and also for making sure we're not feeding into any stigmatization of that community. I have to acknowledge that community. Before I came to the briefing, I had a discussion with the medical officer of health who's leading the outbreak team, and how cooperative and receptive that community is to the supports being provided by public health.
Dr. Strang, given that the full dose vaccination percentage has been more or less crawling since the end of August, why wasn't there more emphasis on Friday's briefing placed on the fact that if we don't actually hit 75 by the 15th, this isn't going to happen? A lot of businesses and people were relying on what was being told about the 15th, and here we are now. So why wasn't that tone shifted on Friday, knowing we weren't there yet?
So let me make 2 things. It was there. The Premier said very clearly on Friday that we have to hit 75. The reason we're delaying moving from phase 4 to phase 5 is not because of our vaccination. I've always said it's vaccination plus epidemiology. We've had a rapidly evolving situation in the Maritime provinces in the last few days, including Nova Scotia. So there's too much risk for us to open up gathering limits when we don't have the proof of vaccination to restrict those gatherings to only people who are vaccinated. So because of it's the rapidly evolving epidemiology that that puts us in a position of delaying for 2.5 weeks. So once, I'm very comfortable with that. We've always been cautious. We're continuing to be cautious. And it allows us to align removing gathering limits, allowing larger numbers of people to get together when we have the proof of vaccination policy in place. For a number of reasons, we can't move up the October 4th date. That's a fixed date. So we have to defer, to be safe, we have to defer moving from phase 4 to phase 5 until we can align it with that policy on October 4th.
Strang, with respect, the 75% target was called a hard target by the Premier. The numbers that the province itself puts out show that there was no realistic chance that 75% would be reached by tomorrow. And that includes the 8,000 military that you keep putting forward. Anyone can do the math, it's there. How can you claim that we've hit 75%?
So it's not about 70, we're going to be very close to 75% by tomorrow, given the appointments we have booked in our system. That may change every day if a bunch of people who are booked don't show up, then so it changes every day, fluctuates here and there. We have about 2% of people, that military and others, that actually, because they're not directly entered into our system, cannot be reported as part of our numbers. So we will be at or very close, less than a percentage point, 75% by the 15th. But I'll make the point again, that is not the reason we are delaying moving from phase 4 to phase 5. Everything we do throughout the pandemic ultimately depends on the epidemiology, and sometimes that can change very quickly, and it has. So therefore, we will still be at our 75% target, but it's insufficient given the epidemiology. We have to now delay for 2.5 weeks so we can align, as I said, opening up gatherings to our vaccination policy. Because we're in the middle of the 4th wave, it has to be vaccinated people only that we allow to get together in larger numbers.
Knowing the risk of the 4th wave, why wasn't phase 5 always attached to the proof of vaccine policy date?
So we've been talking about phase 5 for a long period of time. With the proof of vaccine policy and the approval of that with the new government is much newer. But I've always said it's a vaccination number plus epidemiology. And we were hoping that we could move to phase 5 even last week. Given our epidemiology last week, we were okay with moving to phase 5 and having that 2.5 week period. Things shifted over the weekend in the Maritimes. That's just the reality of dealing with a pandemic. So I am always going to put forward recommendations that keep us with a necessary level of safety rather than taking a risk.
Dr. Strang, you mentioned both PEI and New Brunswick during your remarks. When you look at what is going on there, and perhaps Minister for you as well, when you look at what's going on in our neighboring provinces, what does that make you think about how quickly things could shift here?
The PEI experience shows you that we have to be very careful about what we do with schools. But schools are safe when our communities are safe. So one of the reasons we're acting early on and delaying and hanging on to things is that it's always, you've heard me say this lots of times, one of our priorities in our response is to have children and youth in school if at all possible. So a key parameter that we're working on is keeping our spread in our communities low. So that allows our schools to be safe. Safe communities allow safe schools. So we have to be careful about how much risk we take on to be able to keep our kids in school. We have to be careful about how much risk we take on because we cannot overload our healthcare system. And it all comes back to with a highly infectious Delta variant, you need very high vaccination rates. So even if 10% of our population is unvaccinated, that's enough people to create risks of substantive spread and create pressures on our healthcare system. So we need to slow things down so at least we can align larger gatherings with vaccinated people only, because if you allow unvaccinated people in large gatherings, then that's just way too risky.
So to be clear, with schools, the mask mandate is now shifted at least until the 4th as well, is that correct?
And it's continued extending that at least until October 4th, and there'll be ongoing discussions with our colleagues in education.
An ongoing question that I have heard is why this school year we are not publicizing school cases or cases in schools the way that we did in the previous school year. I wonder if either of you could talk to that policy decision and whether it might change.
So the difference is that in previous waves, we did a press release and included that. We're still modifying the way we report, that we do have to move away from any individual case. That's not so much, any individual case is not so much the issue, it's patterns of cases. When there's a case in a school, we'll follow the process that we use for a whole range of other communicable diseases. The appropriate people in that school, whether it's the classroom, whether it's the whole school, will be notified, usually by a letter that we work with the school and it goes out. No different than, as I said, what we do when we have a case of measles or mumps or chickenpox or whatever. So those who need to know certainly are made aware. But we're in a space now where we need to actually, I guess, bring down some of the focus that we've applied to any individual single case by for instance, by having that identified in a specific press release. We don't need to do that anymore.
32 of today's cases are people 19 or under. Are any of those associated with schools?
No, we've had no additional school cases.
And I'm sorry to keep pestering you about this, but I keep asking for the split between the 0 to 11 and 12 to 19. And you keep saying that, yes, that would be a good number to have, and yet we don't have it.
It's in our weekly epidemiologic summary. Now, I missed that. It's been out there the last few weeks. We don't do it on a daily basis. And again, another thing we're changing. We're shifting more to weekly reports. We don't need to chase every case every day and be talking. We need to look at what are we seeing week by week, and what are the patterns that are evolving as we do that weekly analysis. And the breakdown by age is in that weekly epidemiologic report.
I see a breakdown by vaccination status, but I'm not seeing
It's in there. I went after last briefing last week. I went back and looked, and I was reminded it is in there.
Sorry, Minister, what are you hearing from folks more generally within the healthcare system about how it is coping with this current increase in cases that we've seen over in the last 4 to 5 days?
So I think generally people are concerned. We continue to monitor the cases. You can imagine that there is fatigue in the healthcare system for a variety of reasons, but we do continue to monitor the cases, and we're fortunate right now that there are 4 folks who are hospitalized, and we continue to monitor to ensure that our system can manage any influx of cases.
Dr. Strang,
Go ahead, Pat.
if case numbers continue to rise in the central and northern zone, would public health look at reinstating zone restrictions? What would it take for that to happen?
So we don't have a specific number, Pat. I mean, we'll always look at what's occurring on a geographic basis, and our goal will always be to use focused, targeted approaches, whether that's in a certain segment of the population or a specific geography, rather than the last thing we want to do is have the broad population-wide measures that we've used before. Exactly when and how we would do that is going to always depend on the circumstances and what's in front of us.
Dr. Strang, you've talked about accommodating those with legitimate medical exemptions for COVID vaccines. I'm wondering if there will be something in place for these people to attend bars or restaurants or the events listed as that do require proof of vaccine after October 4th.
Absolutely. So we're working out the final steps in a process to make sure that the public is aware of what those conditions are, and I do need to emphasize that there are only a handful of them, and they're very rare. There's lots of people, I think, who are thinking they have a contraindication who do not. And we're also setting up a process and communicating to primary care providers so they can provide the appropriate letter and information that would qualify somebody then to be accepted as having a valid medical contraindication. But again, those numbers, they're rare, and the numbers of people who qualify will be few and far between.
Parents of elementary school students are anxious and are asking if mandatory masking inside schools would be ongoing until U12s are approved for vaccination. Is that a conversation that's being had in any capacity?
We continue. We have a masking group, which is both within public health, and we have the infectious disease experts, including the pediatricians. We have ongoing dialogue with our education colleagues. So we're continuing to look at what is the need for masking, and does it need to be mandatory and across the board, or maybe there's some certain settings, for instance, schools. So yes, we're continuing to look look at the evidence around that and what's necessary.
Dr. Strang, some owners of venues like bars and restaurants are a bit puzzled that a customer has to present proof of vaccination, but the employees don't. Can you just explain the reason for that?
So there's a very different legal framework as opposed to what's for in terms of the public and what's expected of the public, and we focus very much on discretionary versus essential activities. And what we're saying is for discretionary activities, there's certainly a legal and an ethical justification about doing that. It's very different. As soon as you get into a workplace and somebody's employment, there's a different legal and ethical framework that you have to look at. So we are continuing to look at workplace policies, but our focus is really on the proof of vaccine policy, trying to create levels of safety as we in types of activities where large numbers of people to get together. If everything I just said certainly doesn't, and I said in my remarks, doesn't preclude any business organization going and creating their own vaccine policy. As I've said many times, that's okay, but they have to be aware of the legal, human rights, equity, ethical issues that need to be taken into consideration when they create such a policy.
Are the majority of these fourth wave cases asymptomatic? Can you talk about that a little bit? Are folks symptomatic or asymptomatic, and how many are breakthrough, and what does that mean to you?
So I don't have the breakdown of symptomatic, asymptomatic. I know certainly in the cluster and northern zone that the vast majority of people are symptomatic from that outbreak. We know that cluster, it's all unvaccinated folks. And what we're seeing in the central zone, as I said in my remarks, 20 to 40-year-olds, mostly unvaccinated, but there has been some breakthrough cases. But your question has given me the opportunity to point out that even though we've talked a lot about 20 to 40-year-olds, and that's where the unvaccinated is, we still have some people, even though older ages are highly vaccinated, there's still some people in the older age groups who are not. And they are very vulnerable to severe illness. So regardless of my message to people who are unvaccinated, regardless of age, but especially if you're older, it's critically important that you get vaccinated because you're at significant risk for severe disease.
As for border entry, where are we with that right now? Has anything changed at all, or are we?
No, we're still border entry is whether you need to quarantine and do testing depends on your vaccination status. If you're fully vaccinated, there's no quarantine and no required testing. And if you're not, if you're one dose or no dose of vaccine, you have to go through a period of quarantine and do testing before you can come out of that quarantine.
I'll take one more question in the room, and then I'll have to go to the phones.
Were people in the northern zone cluster that are interconnected, were they in violation of gathering limits?
There's nothing that has been made aware to me of any non-adherence to public health requirements. It's simply a community where they live very socially and lots of interaction between households.
Go to the phones. We'll start with CTV's Natasha Pace. Go ahead, Natasha.
Thank you. Dr. Strang, I'm just curious, obviously starting October 4th, we do need proof of vaccination for anyone 12 or older for non-essential activities like going to a restaurant, a gym, that kind of thing. Why is it that there's no policy for employees that work at those facilities to be vaccinated?
So I think I just answered that question. It's a very different legal ethical framework around workplace. We're focused on ultimately in our proof of vaccine policy that ultimately people have the choice to be vaccinated. It's just there's implications if they choose not to be. When you get into a workplace and people's employment, then you have to be very careful that you're still respecting that choice. But there's a whole different framework.
Natasha, do you have a follow-up question?
I do. Wondering whether or not the province is considering making an overall policy for long-term care homes. My understanding is once we do hit phase 5, each individual healthcare facility will be able to make their own policies for masking and visitation. Is there something the province is looking at to have some consistency across all healthcare facilities in the province?
Yeah, that's certainly one of the things that's on the table right now with our masking group. We've asked them to look at that and come back with some recommendations around where do we want to go post October 4th with masking for visitors in long-term care facilities.
Moving on to the Herald's John McPhee.
Thank you. Dr. Strang, there are still plans to gear down on asymptomatic testing, even though there will still be targeted clinics. But people like the opposition leader, Ian Rankin, he wants the full-scale rapid testing to be maintained. What's the rationale for not doing that?
So, I mean, the rationale is that we have a pool of resources for our testing. We need to focus that where it's going to be most effective. To continue to offer just regular testing for people, like, I'll use myself as an example. I'm fully vaccinated. I don't have a very active social life. If I don't have symptoms, my chance of having COVID is very low. I don't need to have regular testing. So we don't need to offer that generally. But what we do need to focus on is certainly where there is concerns around increased virus spread. Right now, Halifax. So we are going to continue our asymptomatic testing through the convention center and other locations, where we continue to work with hard-to-reach populations, those who may have more challenges to getting good coverage with vaccination, more challenges perhaps with access to health care. With our mobile vans and other opportunities, continue to focus on making sure they have good access to testing. And we are looking at ways that we can support, especially in rural communities, with perhaps take-home testing as we develop that capacity, because they have more challenges of getting to a testing center. And we still have our primary assessment centers where anybody who meets the symptom cluster that could be COVID, we want them to have ready access to testing. So it's not that we're moving away completely from asymptomatic testing. And I forgot to mention, we also have our workplace testing, which is asymptomatic testing. It's a surveillance system, and we now have over 400 workplaces across the province. So we are still doing lots of asymptomatic testing. It's just that we're moving away from the people like me who really don't need to be tested on a regular basis as long as we don't have symptoms.
Go ahead with your follow-up, John.
Thank you. This is to do with the change. I think it was put into place today for the central zone going to what they call a Tier 3 COVID response for their facilities. I'm not sure if the minister could address this or Dr. Strang, but what kind of measures are involved here and how could that affect patients?
I don't have that information with me right now. I can certainly get that information to you later.
Yeah, that's more an internal response in the healthcare system and how they, where they need to kind of take different approaches on patients coming from different parts of the province and what services they may need to be looking at scaling back. But NSH would have the details of what that stage 3 means for them.
Next, we'll move on to Adrian Blanc with Radio Canada.
Thank you. Dr. Strang, are you concerned that we will see a fourth wave like the previous waves, for example, seeing hospitals being overwhelmed with patients?
So I'm always concerned about that. That's one of the things we work really hard to avoid. And we know that our healthcare system is already at pretty full capacity. We have little ability to absorb a surge of severe illness from COVID. That's one of the reasons why, even though we have one of the most vaccinated populations in Canada and therefore in the world, we still are vulnerable because of that 10% roughly of population who's got no vaccination, and that still means that we have to be very careful because we could if we just don't have anything in place to limit the spread of COVID, we could create unsafe surges and unsafe communities, which means that it impacts on our schools, impacts on our healthcare system. So we're even though the vaccine provides a strong level of protection, we can't be complacent, and we have to be very careful about the amount of COVID spread that we have.
Go ahead with your follow-up, Adrian.
And in this fourth wave, would a steep lockdown be the best solution to stop the fourth wave like we saw in the third wave?
So no, we are in a different position with the level of vaccination. It allows us to be certainly much less restricted. And as I've said many times in the last number of weeks, where we do see surges, we expect to be able to control those with a more focused targeted approach. The reason we're just extending everything for across the province for the next 2.5 weeks, it's 2.5 weeks. So rather than trying to go through all the issues about figuring out different levels of intervention in different parts of the province for the next 2.5 weeks, we're just going to continue phase 4. If we then need to go beyond that, we will be looking at, as I answered in my question to Mr. Healy, that we will be looking at a more focused, targeted approach. I don't anticipate, because this is what vaccination gives us. I don't anticipate having to use that widespread lockdowns unless things go completely south, and I certainly hope that doesn't happen.
Next, we'll go to News 95.7's Stephen Wenzel.
Thank you. Minister, the Winnipeg Free Press wrote in July that data from Manitoba showed racialized groups were hit hardest by Canada's third wave of COVID-19. Nova Scotia doesn't release race-based data around health, so we can't compare our data to Manitoba's. Would you commit to sharing race-based data around COVID-19 to help health experts and community organizers better serve communities that are disproportionately affected by the pandemic?
Mm-hmm. So about a week ago, I answered a question about race-based data that we would be releasing and sharing that in January. And so, in terms of the data that we collect and how, I would need to be briefed more fully on that. But certainly, we want to work with communities to ensure that they have access and safety in their communities.
Stephen, go ahead, Dr. Strang.
Support the minister on that. We certainly is a process in place in us developing and looking at that race-based data, whether it's for COVID or for other health issues.
Perfect. Stephen, do you have a follow-up?
Yes, thank you. This one's for Dr. Strang. We still don't know enough about long-term COVID cases that persist over weeks and sometimes months. Common symptoms of long COVID include joint pain, fatigue, shortness of breath, and brain fog. And today, Ontario's Science Advisory Table says as many as 78,000 people in Ontario are experiencing post-COVID-19 symptoms. Is Nova Scotia currently treating any patients with long COVID? And what kind of specific steps might someone experiencing long COVID expect?
So I'm not directly involved in the clinical care of COVID cases, but I do know that some of my infectious disease and other colleagues are looking at this and saying, what do we need to put in place in the healthcare system in Nova Scotia so people with prolonged symptoms from COVID get the appropriate supports and treatment. As you can appreciate, this is very much an evolving field in healthcare.
Next, we'll go to Ed Halverson with QCCR Radio.
Thank you, Dr. Strang. Curious, I've seen a couple of dates being floated around in the press, but I'm wondering what your sense is on when we could actually finally see a vaccine available for children under 12.
So everything that I keep hearing is that it's through the fall before we get the vaccine companies with enough of their clinical trial data to bring that in front of Health Canada, who's the regulator in this country. And so in all likelihood, to get through all those regulatory steps and get final approval, get vaccine out and et cetera, develop a program, it's likely that it's going to be at least the earliest in early 2022 before we'd start immunizing people under 12. If it's sooner than that, that would be great. But that's everything I'm hearing is that's the likely timeline for that.
Ed, do you have a follow-up?
Yes, maybe just could you highlight, Dr. Strang, why it's taking so long? What are the challenges in creating a vaccine for children under 12?
So it's not creating a vaccine, it's the same vaccine. It's just usually, often with kids, you use a different dosage. It's simply the priority was being to get, the first priority was to get evidence for clinical trials for those who are at greatest risk for severe disease, which was elderly. And so the clinical trials for young people were started much later on. So, and it takes time to run those trials, a sufficient period of time to get enough data to answer the questions, what is the safety and effectiveness profile on the when the vaccine is used for kids under age of 12.
Next, we'll go to Lois Andor with the Guysborough Journal.
Hello, good afternoon. The Back to School plan includes use of cafeterias. In some schools, this means a mixing of many grades during lunch when masks can't be worn due to eating. Given the rise in cases, would the province consider giving additional guidance to education centres on this point, perhaps going back to lunches within classrooms as was the practice last school year?
So we're always looking at our back to school plan, and if we saw an increase in cases in a specific school, we would make adjustments that could include, like things like you've talked about. Even though we're getting increased cases, we're not seeing. We've had, I think, 3 cases in 3 different schools. I may be off by a number or 2 there. So we're not at this point seeing substantive impacts on schools that would require us to change our kind of the back to school plan. But as we said all along, we will modify in collaboration with education if we get a specific community with concerning increased activity, or if we get an outbreak within a school.
Do you have a follow-up, Loisanne?
No, thank you.
Next, we'll go to Chelsea Gould with the Toronto News.
Hello, Dr. Strang. With the policy rollout on October 4th, I've heard of some dine-in restaurants who say they're planning to not ask people if they're vaccinated. They're going to welcome everyone. So do you still hope businesses will voluntarily comply?
Well, first of all, we will have a compliance component to this, and we're aware of some of those restaurants, and that information will be passed along to our compliance folks, just like any other rules, whether it's food safety or any other rules we've had all along in the pandemic around numbers allowed in restaurants, etc. If they're not in compliance, there's the ability to provide summary offense tickets under the public health order. So we would do that, but also we would encourage all Nova Scotians to support the implementation of this, and any facility that is going to allow vaccinated and unvaccinated people to get together, I would encourage Nova Scotians to look at that as an unsafe place to visit if it's not in compliance with the proof of vaccination order.
Chelsea, do you have a follow-up?
Yes, thank you. In the Northern Zone cluster, I know you can't identify the community, but could you clarify or give us an idea of what you mean by community? They're social, but what's the type or the population?
So I think we're going to have to leave it as I've described it, as a fairly tight-knit community that has mostly its interaction between households and within and between households, that has some interaction with the broader community, but we have to respect the privacy of the community, and also I'm very cognizant of not stigmatizing any community and putting them at risk as well.
And that's all the time we have for questions today. Go ahead, Minister.
So wave 4 is here, and it is a pandemic of the unvaccinated. The more people who get vaccinated, the less likely we will have outbreaks like the one we've seen over the last few days. The province's new vaccine policy will take effect on October 4th. Higher vaccination rates help protect our younger children and others who can't get the vaccine. If you want to go to restaurants, bars, or movies, or participate in recreational activities, then you need to get vaccinated. There are hundreds of pharmacies and outreach clinics with vaccine. Make an appointment today, please. Thank you.